No, thanks very much for the WVC for letting me speak to you today. I'm currently working for the Department of Industries in Australia, but at the time I was lucky enough to be doing research at the University of Saskatchewan in Saskatoon, Canada. So I'd like to talk to you briefly about antibody concentrations against gastrointestinal nematodes in adult beef cattle and cows from Western Canada. And we have a lovely little catchphrase when doing this research that a cow without parasites is not a cow. So, just to give a brief overview of this presentation, I'd like to touch firstly on the importance of gastrointestinal nematodes, or I call them GIN because it's a long name, in beef cattle, the diagnosis of GIN, and then to discuss briefly a pilot study I did as part of my master's looking at the levels in adult grazed beef cattle in Canada, and I believe it's the first time this ELISA has been used in beef cattle. So the importance of GIN, and we're talking about the nematodes, not the drink, is well documented negative impacts on production. It is estimated in North America that the industry spends up to $2 billion a year in the treatment and control of gastrointestinal nematodes and in the loss of production. This has a great economic relevance for the industry and has had a large effect on the current use of antibiotics in the industry. Since the development of commercially available effective antibiotics in the 50s and 60s, there has been the routine blanket treatment of cattle with antibiotics, leading to an increase in what we're seeing in resistance worldwide in cattle to many of the species of gastrointestinal nematodes. A lot of the current diagnostic techniques utilised are not good enough or specific enough or sensitive enough for us to make targeted selective treatment decisions. That's why producers often choose to use blanket treatment based on perceived production or an actual production increase seen after treatment. What I'd like to kind of try to look at, or what I was trying to kind of look at with my research, is being able to develop what we were calling an impact diagnosis, so looking at the economic relevance of gastrointestinal nematode infections and allowing producers to better select which animals within a herd or indeed a flock to treat as opposed to utilising blanket treatments. There has been a lot of methods used for the diagnosis of gastrointestinal nematodes in grazed beef cattle. These have gone from things like tracer animals or sentinel animals, post-mortem examinations, fecal egg counts, larval cultures, through to the development of testing such as serum, pepsinogen and gastrin, all the way through to things such as serology and DNA technology that is currently being investigated. All of these methods run into issues in terms of quantifying gastrointestinal nematode burdens and being able to relate those specifically to production impacts. I'd like to talk a little more specifically about serology because that is what my research was looking into. It was first tested with a crude antigen for Osteotagia osteotagii because that's considered one of the most important gastrointestinal nematodes in grazed beef cattle by Klisterman et al. In 1993. Bovine serum was initially used, and that moved on to using individual milk samples, bulk milk samples, and even meat juices at slaughter. The most studies have been conducted in the dairy industry using milk samples, and they were getting consistent negative relationships between antibody levels against GIN and milk production, reproductive and mortality industries in dairy herds. A level of bulk milk tank antibody has been established at which treatment of cows has become economically justified, and this work was done by Forbes et al. In 2008. Indirect ELISA is the most commonly used, and there is now a commercial kit available, which is the one I utilised in my project. To talk a little bit more specifically about this ELISA, it has been used on all the same samples as was first tested by Klisterman, so using serum bulk milk samples, individual milk samples, and meat juices. A negative relationship between increasing antibody levels to gin and milk production, reproduction, and mortality indices have been seen in the dairy industry using this ELISA. Negative correlations between meat characteristics and increasing antibody levels have been seen in meat juices. And there has been one study done by Colwell et al. Showing a seasonal or weather impact on antibody levels in grazed beef yearlings, and that's the first test that was done using this ELISA with samples from beef cattle, and that was also done in Western Canada. So now I'd like to talk briefly about the pilot study I used for some of my master's work, which was to use this commercial anti-Ostatagia antibody ELISA in adult beef cows from Western Canada. So the objective was just to characterise serum antibodies against Ostatagia utilising this commercial antibody ELISA kit. We chose to use cattle from, sorry, I'll flick forward. So the study population utilised were pregnant adult beef cows of parity 3 or more. They were taken from cattle that were enrolled as part of what we called the Western Canadian Cow-Calf Surveillance Network. So this was a surveillance network that myself and my master's panel set up as a pilot project in Canada, as they don't have a national monitoring system for diseases in the Canadian cow-calf production system. Samples were collected from July 2014 to February 2015 by private practitioners. An average or a mean of just under 20 cows per herd were sampled, and just over 2,000 samples were collected from 106 herds across the 3 prairie provinces of Canada. And for those of you that aren't familiar with Canada, we utilise the 3 prairie provinces because this is where 80% of beef production in Canada occurs, and this is mainly in the southern part of the provinces, as the northern parts are pretty inhospitable to cattle. Sampling was done by tail-vane venipunctures. Samples were sent to the University of Saskatchewan, where they were centrifuged and then frozen at -80 until processing. The commercial antibody ELISA kit was used according to manufacturer's instructions, with the exception of serum being used as opposed to milk samples. The serum was also diluted at a 1 in 140 with PBS tween, and this was validated by Colwell et al. In his study. Individual cow optical density ratio achieved was standardised using positive and negative sera in duplicate on each plate. Mean standard deviation and range of individual cow ODI were calculated by cow herd size, cow age, and cow body condition score. A multivariate linear regression model was built by backward stepwise linear regression with a significance level of less than 0.05 set. The effect of herd was included to account for the overdispersion of gastrointestinal nematode eggs in herds of beef cattle. So we had a cutoff of herds with those greater than 300 breeding cattle. So small herds were defined as less than 300, large herds were those greater than 300. A single ELISA ODR threshold of less than 0.5 and another of greater than 0.8 was set to describe animals with a high or low antibody, and this was based on results obtained from studies with dairy cattle. So table 1 shows the summary statistics for the individual cow optical density ratios collected. We had an average optical density ratio of 0.79, which is pretty similar to those seen in adult dairy cattle. The only difference that we did see was with cow age. So we saw a statistically significant difference between the optical density ratio in cows younger than 3 years old with those that were 3 to 8 years old and those greater than 8 years old. Figure 2 is a histogram just showing the individual cow optical density ratios with the reference lines placed at 0.5 and 0.8, and those were used to describe those less than or having a low antibody level and those having a high antibody level. And the results showed that approximately 70% of cattle had an optical density ratio above that 0.5, and about 30 had that above 0.8. So a considerable amount had what we describe as a high antibody level, above which it became economically significant in dairy cattle to treat. And just to compare this work with some of the work done in adult dairy cattle. So we got similar results to adult dairy cattle in Belgium, and they had, the reason I picked that result out is because they had a high proportion of grazing compared to a lot of the other studies which were done on dairy cattle that didn't have a lot of exposure to grazing. When we look at it compared to results from Canada or Eastern Canada, it was higher than those seen in Eastern Canada, but again, a lot of those dairy cattle don't have the exposure to grazing that obviously beef cattle do. And then when we compared it to the one other result in yearling beef cattle, it was a good deal higher, and we believe that's due to repeated exposure of these cattle to gastrointestinal nematodes throughout their life. So in conclusion, the results of the pilot study show that there is variability in the ODR of adult beef cattle. And like in the dairy industry, this means there is the potential to use this test to assess for production impacts of gastrointestinal nematodes. Further studies need to be done to explore longitudinal sampling over a year to explore seasonal variability. The relationship between the ODR and predictors such as age, parity, season, and production status all need to be explored. And perhaps the relationship between the ODR and measures of production such as calf weaning weight or pregnancy rates could be considered. I'd just like to thank my Masters Committee, my funding, which was from the Saskatchewan Government and the Beef Cattle Research Council, and also from the New South Wales Government for sending me. And also a big thank you to the University of Saskatchewan and the WBC.